Good afternoon, everyone. Welcome to a bright morning on a Sunday. Now it's afternoon. So, we again have Dr. Swati Arora back with us. Thank you, Swati, for taking out time. As our viewers know, she is a dentist and she also has been studying and, doing, regular, upgradation of her skills. She is a certified implantologist. So, Swati, welcome back. Thank you so much. How are we?
Thank you, Richa. I'm glad to be here.
I think you'll have to be a little louder. Hi.
Hi, Richa. Thank you so much. Thank you for having me again.
Thank you. So, Swati, today's topic, which we thought, we can let our viewers know about, is about tooth polishing. So, can you let us a little bit more? Or what is tooth polishing? What is the term and how to define it in your parlance?
Yeah. So very correctly said that what is the term? So the correct term is tooth bleaching or tooth whitening. Okay. It's not tooth polishing. Now,
Okay.
everybody wants white, shiny teeth, right? But naturally, the shade of our teeth varies little bit from person to person. Just as our complexion varies, so does the shade of the teeth, right? But with age, with use, in the sense that we are eating so many things, and especially in Indian cooking, we have so much of haldi and so much of other spices being used. So teeth start to get stale. So basically, tooth bleaching or tooth whitening is removing whatever add-on discoloration or staining on the tooth is there and making them a shade whiter.
Okay. So basically, as we say ना, मुझे मोतियों जैसे दांत चाहिए, तो it is for that. So there are different terms. So in layman terms, we can have two or three different kind of terminologies. So Swati, how do we do this? What is the process? How to go about it?
Yeah, so we'll discuss it in a very general term, in a general way, so that everybody understands the way. So basically, when you come to a dentist and you say that my teeth are, they're looking yellowish or they're not as white as before, I want them to look whiter. So there are two types of stains. One is extrinsic. Extrinsic, like the name says, जो बाहर से है, right? External. And one is intrinsic, जो कि internal हो गया, right?
Okay.
So extrinsic stains are first to be cleaned with a cleaning machine or the cleaning device, which is called scaling and polishing. That's an
Okay.
ultrasonic instrument that you take and it removes whatever deposits. Layman term में people know it as calculus या plaque. वो जो
Yeah.
पायरिया कहते हैं जो दांतों के ऊपर जमा हो जाता है. So the initial step is to remove whatever is added on to the tooth surface externally,
Okay.
right? So this is not extrinsic stain. So that remains to be added to the tooth. Once that is done, that is the first step for any type of white. Once that is done, then we give a few days break and then we go on to remove the stains which are intrinsic. Now, how do you get stains intrinsic? कैसे हो गए? It can be age related. It can be because of different foodstuffs, like I said, like haldi, tea, coffee. These kind of
Nicotine, smoking.
exactly, smoking, nicotine, very good. So they sort of enter or leach through your enamel and they
Yeah.
over prolonged they cause little bit of discoloration of the enamel. And sometimes stains are also induced by drugs. प्रेगनेंसी में देते हैं टेट्रासाइक्लिन इंड्यूस स्टेनिंग हो जाती है
Okay.
so teeth look yellow. Okay, so now once your external stains are removed and you want whiter teeth, then we have a process which is called tooth whitening or bleaching of teeth, which is
Okay.
recommended to remove in the intrinsic state.
Okay.
Okay. So now tooth whitening is of two types. It is in office, that is what the dentist does on the chair for you. And it is
Okay.
at home bleaching or whitening, which you want to do at home,
Okay.
right? So
But
सबसे हाँ,
is it safe to do on our own? Because a lot of times we keep rubbing things, Colgate, ye, wo peep. I've seen, there's a lot of hearsay कि you should use raak. Raak lagao. तो
harmful activity case भी तो आ गया.
yeah, yeah, yeah. But is it safe
So
to do it on our own at home?
So that's a very good question, Diksha. See, at the end of the day, whenever you are using anything which has either charcoal or it has some whitening agent or anything, so there is something extra added on in it, right? So
Yeah.
there is some. abrasive in it. Even that toothpaste or rack, like you're saying, so that has an add-on abrasive agent. So
No, I
are
was
you
just
there or
focusing
I've
on,
lost you?
no, I was focusing on you so that you get the full screen. Yeah,
So
yeah.
we have
I
an
got it. Yeah.
add-on, we have an add-on agent in these kind of things, which is very abrasive. Abrasive मतलब वो दांत को रगड़ रहा है, abrade कर रहा है tooth के surface को और फिर उसको white दिखेगा आपको, right? But the negative side of it is कि if you leave an abrasive surface, आपको जो कोई चीज उबड़ खाबड़ है abrasive हो गई है, तो उसको फिर से stain attach करना भी बहुत easy है. So
Also,
one
the
is that.
enamel also wears off, I think, now on your own, then it's more detrimental.
Yes. And at home use of these toothpaste or whatever is not controlled. You don't know कि मुझे कितने दिन करना चाहिए, कितना करूं, अब मैं छोड़ दूं, मेरा enamel abrade हो
The
रहा है या नहीं.
pressure, everything, yeah, because I think we just tend to overdo it. So, Swati,
Yes.
coming back to the question, you were saying there were two kinds, intrinsic and, external.
No.
So,
So
that
then
I
there
think,
are two types of bleaching also. Now, so
yeah,
let's first talk about the bleaching which is done on the dental chair by the dentist under controlled conditions. Okay.
got it.
So
Yeah,
you get the cleaning done first, scaling, and you remove the external stains. Then you go talk and discuss, and then you get a further appointment after a few days for in-office bleaching or white. Now
got it.
here you come on the dental chair, and we first take your shade, or what is the shade of your tooth today,
Oh,
right?
wow.
And then we apply, see, like any bleaching agent, even when now, like I was saying about toothpaste, same when I'm using it on the chair, my bleaching agent also has some chemical which is
Yeah,
slightly going to penetrate your enamel and it is going to remove the stain from there. So I need to first, there is a gingival dam, something that we apply, which protects your gums. Because if this
okay.
agent is good for the teeth, it leaches out onto your gum, you can get burning, you can get a lot of sensitivity, irritation. So first that is applied. Once that is done, then we apply our activated agent and it is applied on all the surfaces of the teeth for a fixed time under our care and you are just sitting comfortably. In fact, it takes about 15-20 minutes and most patients also tend to fall asleep while this procedure is going on. Now, bleaching can be chemically activated or it can be light activated. So, a lot of times people have seen that somebody is focusing a big light on their face and they are just lying down, eyes aise aate. So, that is
Yeah,
light activated whitening.
okay.
And
Wow.
there are agents that are also chemically activated. So, we just mix them and we apply them and we just leave it.
Okay, nice. So,
It is
that's
clean.
your
You
recommendation.
recheck, yes. And once it's clean, you recheck the shade of the tooth and you can have 2 to 3 sittings depending on how light you want the shade to be.
So, but this will be, foolproof. It will be with all the guidelines, so it will not harm the teeth. It will only just, make them lighter and the shade which you want. I'm really excited with the shade card. I didn't know teeth come with shade cards as well.
Yeah,
That's a
even
new
cap
information.
for a dental crown or a cap. Then also we check the shade of your adjacent teeth and we tell the lab which shade it is to be made because everybody wants them to match perfectly and to look natural. We are no more in
Okay.
the age of gold crowns that I want a gold crown,
Oh,
right?
wow. Okay.
We are
So that was really
specific.
informative. So coming back to this, so how frequently should one get done, and what age group are we looking at here?
Yeah. So, first of all, bleaching is not recommended below the age of 13, 14. All right.
Okay.
So, for children's teeth, if anybody says that my child's teeth are yellowish or they are not clean, that requires cleaning. That is scaling, which I told you, that you remove the extrinsic stains. All right,
Yeah.
because children are brushing properly. Bleaching,
Yeah.
which is internal stain removal and whitening, is only recommended for adults 14 years plus once all
Okay.
your permanent teeth is done. Right.
Okay.
Then the bleaching process, once done in the clinic, lasts for anything from 1 to 3 years.
Oh, wow.
Okay. So that is depends on you. Post bleaching, you are given simple instructions like avoid tea, coffee for a week or so, okay, or reduce it as much as you can. And when you eat something, you'll be having a regular food, or you've had chai also, then you rinse immediately. Rinse your mouth with
Rinsing.
water
Yeah.
after. So if you're following those instructions, then it lasts from anything from 1 to 3 years. Okay.
Oh wow, that's nice. And tentative cost range, just to get an idea, because now it's becoming so common. So it's like another visit where it's more cosmetic
Yeah,
than
it is
yeah.
little inexpensive treatment. So see, Richa, it varies from like, area or where you are
Just
located.
a precise
Most
figure, 5,000, 10,000, that range.
bleaching is done like nobody does it for a single tooth. If you're
Yeah,
getting your teeth brushed, yeah, you go in for at least your anterior 6 teeth would show in your smile.
yeah.
सामने के teeth, yeah, your incisors and your lateral incisor and your canine. So for 6 teeth, anything it can range from 8 to 10,000 or more, depending on
Oh,
which
great.
bleaching your doctor is using and how many fittings or how
Sessions,
many
yeah.
you're requiring. Right.
Oh, great. So, viewers, please keep this in mind. If you want to, have 32, smiley, smiling pearls, and have a great smile, you need to visit. And as we had, also discussed in our last session, rinsing is so important. I think we, have forgotten how to rinse. We're always on the go. So, I think rinsing, I think, is a must, which I've also inculcated in my regime. So Swati, what about the toothpaste? We keep seeing these ads, tooth whitening, toothpaste out in the market. How effective are they?
Which are they are effective. All right. Like I said, they have abrasive agents and they also have some chemical added on it, which is milder than the one which is used in the chair. All right.
Okay,
So they are effective, but they should be used. By, see, we also give in office ke alawa, we also give bleaching kits at home. They are not
okay,
toothpaste. Yeah, they
okay,
are these specially activated syringes. So when you come and you want at home bleaching, you are given a tray which fits your mouth and you
okay.
are given this chemically activated material which is of a lesser potency as it is in the in-office bleaching.
Oh
And
wow.
you are advised to place it on the tray. You are taught how to place it in your mouth. You start by using it for 1 hour every day, and once you become comfortable, then you are advised to use it after a week or so for the night. Place the tray in
Oh
your
wow.
mouth and sleep off. And then in the morning, you wake up and you rinse it off. The main common problem that people face with bleaching, whether it is at home or it is in the clinic, is sensitivity.
Yeah, I was coming to that.
So that is to be monitored, that is to be checked, and it is a common side effect, but easily manageable. Like if you're getting it done in the clinic, you feel the sensitivity immediately, you will be advised appropriate toothpaste or appropriate care. And when you're doing the home bleaching kit also, you should be in touch with your dentist so that once if you have these symptoms, you can find out. And this has to be stopped once you have reached the shape that you want. It generally
Okay.
takes about 2 weeks or 20 days, after which you should discontinue the use.
Oh, great. So it has to be monitored, it has to be under supervision. So please don't do it on your own. I think once you have initiated, I know we want to maintain our color. So it's always good to walk the path with your doctor, because then you are under supervision and it's not like curly and everything, because it might cause more harm, as Dr. Swati mentioned about the sensitivity and abrasion, and maybe just overdoing it, which will not help you in the long run. So Swati, and one more thing, like you said, we need to have certain restrictions, not have tea, coffee, and then tooth sensitivity. So any other precautions one needs to take? Like suppose I want to get it done, so I can eat and drink anything, thanda garam, anything after that.
I want to emphasize that teeth bleaching is very safe and it is painless and it is not harmful. It's highly recommended if you are not happy with the color of your teeth or you feel that you are not having the confidence to smile. But whether at home bleaching or in office, like you very rightly put, take the suggestion, take your dentist in the loop and do it with somebody's guidance so that you don't end up harming your teeth, you don't end up abrading the enamel more than what is required.
Yeah, that is needed. I think, I think we Indians, we have doctors ourselves. We all want to do everything ourselves. So please keep that in mind. This is one area where, because teeth, I developed teeth sensitivity once, and I think twice, in fact, now. And then I've been so careful. So I'm like, don't, touch things which you can't repair on your own. So Swati, thank you so much. And I have a great news for our viewers. We are going to run a contest. Swati will, choose a winner and, give 10-15 minutes of, her dedicated session to that lucky winner. So we are going to float the contest soon. So thank you so much, Swati, for taking out time. Such an enriching session, and see you soon with the series. And, your guidance and your, knowledge is really helping all of us. So thank you so much for coming over today. I know you're at your clinic in between patients, so can't thank you enough for this.
Thank you so much for having me.
Thank you. There's one comment I leave with that. One viewer has written that it's such an informative show. Thank you so much, Dr. Swati Arora and Richa, for this. Thank you.
Thank you so much.
Good day. Good day, viewers. Bye, Swati. Thank you so much. Good day to you.